Hello, my name is Elliot Marseille, and I'm the founding director of the Global Initiative for Psychedelic Science Economics at the University of California, Berkeley. And we are set up to do the economic appraisal of psychedelic-assisted psychotherapies. So the logic here is that until recently, it made sense to really focus all resources on understanding the safety and effectiveness of the emerging therapies. At this point, we know enough about the effectiveness that it's time to also include an understanding of the economics of the new therapies. So the idea here is that third-party payers and the public at large and service providers and other stakeholders have a good data-based understanding of what the effect of these interventions are going to be for the health of the public, but also in terms of the cost to payers over time. So we're dedicated to doing cost analysis, cost effectiveness, cost benefit analysis, all of which evaluate sort of value for money of these interventions. We are also interested in price analysis and modeling the large-scale impact of these interventions as they are brought to scale and a significant number of the people who could benefit actually have access to it. So how many lives would be saved? How many quality-adjusted life years gained? And what is the overall impact on the healthcare budget of the United States or another country or a region within a country or a state within the United States? How is it going to affect costs over time? My background is, so I'm relatively new to psychedelics. I started working in this area 4 years ago. My background is in global health and in particular, the economic evaluation of HIV/AIDS programs in developing countries. And about 4 years ago, I had a meeting with Rick Doblin in which the result was I realized that I wanted to put significant time into evaluating the economics of psychedelic therapies. And that progressed over time. And now I do this full time. And about a year ago, we established GIPSY, the center I mentioned, the Global Initiative for Psychedelic Science Economics. To give you a little idea of what we're working on now, so we've done substantial work on the economics of MDMA for PTSD. We're working now with Johns Hopkins on the cost effectiveness of psilocybin for smoking cessation. We're working with the USONA Institute on cost effectiveness of psilocybin for major depression. And we're also doing a systematic review of the evidence of the effect of psychedelics in non-clinical settings. So what's the public health impact of increased access to psychedelics, again, in non-clinical settings? We recently submitted a proposal to the Department of Defense to evaluate the potential benefits and costs of MDMA therapy for active duty military. So that's under review. There are other projects, but I'll just mention one more, which is we're modeling the cost effectiveness of ibogaine for opioid use disorder. So we see that there's a tremendous amount of work to do in this area. We're growing a network of collaborators as fast as we can. And we're excited about the opportunity to make a contribution here.